When I learned from my patients, the types of procedures that they were having done and who they were getting them from, I was a little shocked. And then when I looked into the regulations around med spa world, it's highly variable, and sometimes there's almost no regulation at all. I think it's important for people to realize that some of these procedures can carry serious risk, and they should be done by a qualified person.
There are a lot of non-physician professionals who are very qualified and very skilled, and they have very great results. They are very big advocates of patient safety as well. So it is really about qualification and also the experience and being tuned to what the patients are looking for.
You Are Beautiful, podcast with J. Kim, MD.
Welcome to the You're Beautiful podcast with J. Kim, MD. I'm your host, Dr. J. Kim, a facial plastic surgeon, and I'm on a mission to make the world a more beautiful place, starting with you. There are 3 undeniable truths you must embrace to become the most beautiful version of yourself. The first is that you are beautiful. The second is that you are unique. And the third is that you are worth it. Let's dive into today's episode. Today I have with me a wonderful guest hailing all the way from Colorado Springs, Colorado. This is Dr. Rachael Degurse, and she is a highly accomplished and compassionate physician. She is a devoted mother, an entrepreneur, and an advocate for personal growth. She strives to empower individuals, including her patients, on a journey of evolution and transformation. Dr. Rachael Degurse's unique blend of medical proficiency, her nurturing spirit, and entrepreneurial acumen make her a very trusted ally for her patients who seek a transformative change. She is embracing the role that she has as a guiding force to empower individuals on their way to growth and personal transformation. I want to welcome Rachael to the show. Thank you so much for joining me on the You're Beautiful podcast.
Thank you for having me. I'm excited to be here.
Yes. So Colorado, there's a lot of snow. The winters can be quite brutal. And having lived in Buffalo myself for quite a few years, I know what a brutal winter is like. How was this past winter?
The nice thing about Colorado is even if you have a brutal winter, it gets sunny over 320 days of the year. So it can be bitterly cold, but at least the sun is out, and that just makes it not feel as bad. So even on the bad winters, it's pretty great.
I remember in college, some of my friends who were from other states, like on the West Coast, they thought that sun equaled warmth. And so they did not understand the fact that it could be sunny, but still cold outside.
Oh, that is so true. Yeah, there is a lot of, because I'm a native from Colorado and I went to undergrad here, and there was a lot of people from other states who didn't understand that concept and would be outside in shorts in January, and they regretted that decision pretty quickly.
Oh, very much so. So I tell this to my patients every day, and I'm sure you do to a lot of your patients as well, is that even if it's cold, even if it's cloudy, you got to put on an SPF, right?
Oh, yes, absolutely. Every day, even if you don't go outside, because you can get some UV exposure from indirect sunlight and damage even from indoor lighting. So SPF every day. You wake
Absolutely.
up, you put it on.
You're preaching to the choir. All right. So let's just start with, how did you come to this point where you are today as the director of a med spa, as an entrepreneur? How did you come to this point to make the world a more beautiful place in your own way?
Oh, thank you. So as you mentioned, I've been in practice for over 13 years as a family medicine physician doing general primary care. And I worked for a small group practice and really loved it. And then, as many have experienced in their office settings, my office was purchased by a large corporation, and all of a sudden the job that I loved looked a lot different. And I spent a lot less time with my patients just because of the changes that they enforced, and it became a lot less gratifying to me. And I decided I needed to make a change. And one of the ways that I decided to do that was to practice medicine in a different way and open a med spa where I could, still have one-on-one connection with people and talk to them and get to know them and what their priorities are and their journey and their life goals. And I didn't have a corporation telling me I had to do it in 15 minutes.
Yeah.
That's really what spurred my desire to open the practice, and it's been really great since I did. We've been open for almost 3 years now, and
Wonderful.
it's growing and offering more treatments and services. But the main thing is that I get to talk to people and sit down and get to know them.
Yeah. I mean, how important is that we as healthcare professionals, much of how we take care of patients is by listening to them, talking with them, the quality time. And in so many settings, unfortunately, there are outside forces kind of dictating that time and how we use it and how much we're allotted. So I agree that for me, even through medical training, residency, fellowship, all those different aspects, I didn't mind spending a few extra minutes, like sitting at a patient's bedside, even if it was something totally not about their disease. It could be about their hobby, it could be about their family. It was developing that relationship with them. And I figure you've seen that play out at Pearl as well.
Absolutely. Yeah, I actually, because I create my own schedule here, I give myself a minimum of an hour with all of my new people so I can sit down and I really get to know people. And, I think that everybody who goes into medicine does it because they love people at their core, and you really need to get to know somebody, who they are, to really help them and what's important to them.
Absolutely. In terms of your going into family medicine at the beginning of your career and then transitioning into this med spa setting, I figure you went into family medicine largely because of that continuity with patients and even with their families, right?
Oh yes, yeah. When I left my previous job, I had quite a few families that I had seen, 3 generations in the same office for, a decade. And that was really great. It was hard to leave that behind, but
Right.
hopefully I'm developing new relationships.
Yes, absolutely. And one of the good things, I guess, about the work that we do is that generally our patients are physically healthy. And so that's a good place to start in terms of building that relationship, right?
That is a good place to start. Yeah. Although, sometimes people come into a med spa or plastic surgery clinic and they do have other medical conditions, and it's important to factor that in when you're providing treatment safely. So, I think it's important to seek these procedures from somebody who is qualified and knows more than just how the technique is done, but can ask those questions that are important. Like, are you on blood thinners? Do you have diabetes? Like, is your diabetes controlled? Like, those are all really important factors, and making sure that your results are as good as they can be, and they're done safely.
Right. And even, in the States or even in somewhere like Korea, we see it all the time where the credentials or the qualifications of a treating professional or so-called professional can come into question. And so I think one of the messages that we were talking about before we started to record is that the qualifications, the credential of the professional who's taking care of you is really, really important, right?
Yes, I absolutely agree with that. That's part of why I decided to enter the med spa space specifically, because when I learned from my patients, the types of procedures that they were having done and who they were getting them from, I was a little shocked. And then when I looked into the regulations around med spa world, it's highly variable, and sometimes there's almost no regulation at all. So I think a lot of people expect, in their mind, they expect a certain level of qualification, but they're not asking the question, and they just make an assumption that may or may not be accurate. And I think it's important for people to realize that some of these procedures can carry serious risk, and they should be done by a qualified person.
Absolutely. So if you had to whittle it down to one question that a patient should ask the professional, what would that be?
Well, I would definitely ask, how many of these have you done? I mean, there are very experienced nurses out there, for example, who are doing injections. So that, somebody with 7 years of experience is very different than somebody who, did a weekend course, who has the same level of technical medical training. But experience level does matter. So I would think that, how many of these have you done? And secondly, I would want to know what their medical background is. Are you a nurse? Are you a nurse practitioner, PA, physician? That definitely comes with highly, very different levels of medical expertise. So I think that that's very important to understand before you go into a procedure. And maybe you still choose to go with somebody who, is an RN versus a nurse practitioner versus a physician. That's possible. Maybe you just connect with that person better. But I think it's important to have all of that information before you go into those, procedures.
Right. Yeah, I agree. There are, especially in the bigger metro areas, including here in DC, there are a lot of non-physician professionals who are very qualified and very skilled, and they have very great results. They are very big advocates of patient safety as well. So it is really about qualification and also the experience and being tuned to what the patients are looking for in terms of quality, safety, things like that.
Exactly. And, I think sometimes when people look at a med spa website, they might see a physician's name on there, but, that person may or may not actually be in the office. Technically a lot of places only need a medical director, and a medical director might not be there in the office if something goes wrong. They might not even be in the same city or state. And they might also have no experience with aesthetics. You can technically become a medical director of a med spa just because you're a physician, but you have no experience with any aesthetic procedures. So if there is a complication, how experienced is that person dealing with it?
Yeah. So I think one of the big areas of potential complication in a med spa setting can be a vascular occlusion when you're injecting filler. And so I'm sure that as someone who is very concerned about qualification, about protocols, safety, you have a protocol if that were to happen in your office, right?
Oh, absolutely. I've got, Hylenex on hand. I didn't even inject filler into anybody until I had at least 2 years of practice with it. So I, just because that complication specifically is so scary, I didn't want to risk doing it until I was 100% confident that I could do it with the utmost safety. So I've got Hylenex on hand. I have, my hot packs. I've got my specialist that I can call in case of absolute emergency. And of course, I'm in a large area, so, the ER is pretty close, but I've not, hopefully, never have that happen or necessary, but I'm prepared just in case.
Actually, that does bring something to mind. And when you mentioned that you have an emergency department nearby is that I get the feeling that we as aesthetic professionals, when we see headlines about complications related to aesthetic procedures, we know what's up. But in terms of your run-of-the-mill emergency departments, they don't, right?
Oh, yeah. Yeah. That would be a situation if I had to send somebody to the ER, I would call ahead and say, this is what's going on. This is what I've done. This is the next steps that need to be taken. I just don't have the, imaging or access to the specialist on call that I would need.
I'm sure you do this with your practice too, is that with every patient who's had an aesthetic treatment with us, we make it a priority to tell them that if there's any concern to give us a call.
Absolutely.
I or someone in the office, no matter what time of day it is, we will get back to you. And if it's that urgent, we will do whatever we need to make sure that you're safe.
Absolutely. Yeah, I make sure that all of my my guests have ample ways to contact me at any time of day. I have a really bad habit of responding to non-urgent things, even like at 8 or 9 o'clock in the evening, just because I see it there and I want to get that taken care of. But it's also, I know, comforting to people to know that they can reach me and get an answer quickly.
Yeah. And just circling back to what we were talking about before, I think that if we were rushed, that if we had only 10 or 15 minutes per patient, that we would not be able to build that trust to help patients through that sort of situation if it were to happen, right?
Oh, absolutely. Yeah, I think that, relationships take time, and that's any relationship in your life. And especially a patient-physician relationship that requires a lot of trust and, understanding on both sides. And you just can't do that in a quick time frame. And that's something that I don't feel like a lot of the companies that are taking over these, any office. I mean, there's a lot of healthcare organizations, not just primary care, that are kind of entering into these large corporate structures. I don't think that they understand that as much as, the physician does, because we're the ones sitting in front of people and trying to form a bond with them and get them to trust what you're recommending. And it's just not something that happens in seconds or minutes.
Yeah. Let's say in the past couple weeks or month, is there a certain patient relationship you feel like, wow, I really helps that person achieve a more beautiful version of themselves and they feel happy and I'm happy about it too? Can you tell me about someone like that?
Yeah. So I fairly recently saw a lady who had some filler that she was unhappy with. It kind of gave her an outcome that she wasn't expecting. And so we talked about the goals and kind of I went over a few different options with her based on she has a trip coming up, so she wanted to get things taken care of as quickly as possible. So I kind of discussed some various options that would achieve her goals and certain time frames and also like within her budget. And we came up with a plan, and I just heard from her yesterday that she's like feeling really happy about her results, after we've treated her like 3 times now to kind of stepwise approach her concern and get it resolved. And I asked her if she could come in briefly to see me for a follow-up, just so I could take a look and make sure that everything was, to her liking, and make sure that she's feeling absolutely comfortable. And if we need to do any further steps when she returns from her vacation, and she's going to come in and see me tomorrow. But I was really happy to hear that she was feeling good and that she's feeling ready for her trip, and she's going to visit some friends she hasn't seen in a long time. And she wanted to make sure she looked her best for that. And it felt really good.
Yeah, a couple of things I gleaned from that is that this patient had the right motives and the right mindset when it came to what she wanted to achieve and what it was for. And it was for herself ultimately, right? I mean, it kind of is to like look good for a special occasion in terms of meeting old friends and things like that. But in the end, it is for herself.
Yeah, I think that, when you feel like you look good or you're feeling confident, that really it makes you just feel better in a lot of ways. And if you have like one thing that really sticks out to you and bothers you and makes you feel self-conscious, then you know sometimes people start avoiding social situations because of that, or they don't want to
Mm-hmm.
go and do the trip or wear the outfit because they just feel self-conscious in it. And then you start eliminating things that give you enjoyment in other areas. So if you can
Mm-hmm.
address that and improve your feelings about how you're projecting yourself to the world and your confidence level, then it really makes a big difference on just your overall mental health and well-being.
Yeah, definitely. I agree with that wholeheartedly. The other thing that I noticed when you were telling me about this patient is that it's not just one visit and everything's done. So
Yeah.
much like we were saying that the duration of each visit can be longer and you can spend more quality time, it's not just those visits in and of themselves, it's how many times through which you develop that relationship, right?
Oh yes, definitely. I don't know that there's many things that you can achieve worthwhile in life that you can just get done in a quick visit.
Mm-hmm.
That'd be nice, but I I do think a lot of times it takes a little bit of patience and work and maybe a stepwise approach. It's more of a
Mm-hmm.
journey,
Yeah.
and I'm sure you see that a lot in your practice. That
Mm-hmm.
you would love to make people feel like they come out of surgery and look 100% like how they want to look like immediately, but it doesn't. It takes healing time and
Right.
maintenance afterwards. You got to take care of your skin and wear your sunscreen. So, it is a process.
Like you said, even for patients who have one procedure, and in my situation, we'll just say, for example, with surgery, you wish that, oh, immediately you look like the after picture that's website worthy. But of course, it's not.
Yeah.
And so I think for a lot of my surgical patients who do well, it's that mindset of, I know what to expect. And if there is any question along the way of, is it supposed to feel like this or look like this X number of days into the healing process, I'll call Dr. Kim and say, oh, is it supposed to be this way? Or I have this concern, that concern. And I'm always happy to take those calls.
Yeah. I think that that's really important for basically what I hear you saying is, you've developed a relationship with people so that they have appropriate expectations leading up to the procedure. But,
Mm-hmm.
sometimes they still have questions afterwards, but they feel comfortable enough like coming to you, which is part of that relationship you've built with them, which is really, really good and valuable.
Absolutely. Yeah, I think this relationship that we build with our patients, even in a rather superficial situation when it comes to beauty rather than some other grave health condition, is so important. Are there situations where you will say no to a patient?
Yes. Unfortunately, well, sometimes people think that they want something that actually doesn't achieve what they think it does.
Mm-hmm.
Um, so there's so many times that people come in. The one I can think of most commonly is like neuromodulators, like Botox.
Mm-hmm.
There's so many times that people come in and they're like, "Oh, I think I need Botox," and then I ask them what their concern is, and they,
Mm-hmm.
describe like their skin texture or they've got like loose skin. And I'm like, okay,
Mm-hmm.
well, then we have a discussion about what Botox can do and what it can't do. And I tell them, like, I'm happy to give you Botox, but it's not going to fix what you want fixed. So let's come up with a plan that's going to address your actual concern. So I definitely say no in those situations, but it's more about educating, like what these procedures do and what they can't do. And then also there's some contraindications to some of these things. Like there's not a lot of them, but I had a lady with a pacemaker, and you can't do radio frequency microneedling with that. It's a contraindication. So, pacemaker is a little bit more important. So, there's certain things where you have to be able to know, like, what the contraindications are to these procedures, and then maybe there's an alternative that's better for that person because they can't do those procedures. Maybe they get a laser, or maybe they need a neck lift or a facelift instead, and then that's when you I refer to my surgery colleagues when I'm like, this, you're just not a candidate for this particular procedure, but there might be something else that can achieve what you want in a different way.
Yeah. More than a handful of times, I have patients who say, I want Botox because I have these lines here.
Oh,
and
yeah.
I'm like, oh, again, this, Botox is not what helps you there.
Yes.
And so going along with that, you have to wonder where this misinformation comes from or this misconception comes from. And I do think that a large part of it is what people see online now is that they think, oh, a certain injection, and they might just think that all injections are called Botox. That could be one misconception about it. But the other thing is that, oh, I only paid X number of dollars at some unkosher place of business, and I felt I looked better after this. So, what do you feel like our role is in online communication about what's good, about what's safe, about what's effective?
So I do try to post like educational content at least once a week on our social media, and I have a blog through our website. So I do do a lot of that. I also have an article that I write for a business journal, just talking about these kind of really common aesthetic concerns and just kind of demystifying them, debunking them. Because I think that as a physician, and you probably feel the same way, that our primary role is educating people. When you sit down with somebody, my first goal is to kind of teach them like what these things can do and what they can offer them, and just educate them about pros, cons, risks, benefits. And then that person can make a decision with all the information, if that's something that they feel is good for them.
Right.
And that's hard to convey accurately in TikTok. So it takes consistency and, multiple postings, and still sometimes you'll get people who ask questions, and you just have to, educate them the right way.
Yeah. There's so much information about there. And when our potential patient is doom scrolling and just seeing information from all over the place, and one of the things that gets me sometimes is, I mean, I don't know your take on threads, but I see people who have like 20 different threads all in their face all at one time. And of course, anybody who scrolls is going to stop and say, whoa, what's that? And then become interested. And so for me, I think sometimes social media is like whatever piece of content I'm throwing into the ocean is like a tiny drop in this big ocean of information. And it's hard for our patients to discern what's good information from what is less than good information. So I think it's a constant effort to get the right information out there.
Absolutely. Yeah. I don't offer threads because every plastic surgeon that I've ever talked to hates them. So that's usually a good indication for me not to do them. But yeah, I don't do them for that reason. But I know exactly what you mean. Like if somebody sees this really shocking or amazing result on social media, perhaps like you could have the same results. But I like to give realistic expectations, and then say here's what would be the best case scenario and here's what is a realistic scenario, and if we get somewhere in between there, then I feel like we can both be happy.
Right. And I think in terms of the education we give to our patients, I wish we could clone ourselves to some degree so that it was in every prospective patient's ear. And I think there are ways of doing that, like, email blasts and our Instagram stories and other tidbits and whatnot. But in terms of the landscape, I mean, the aesthetic landscape is changing so fast. Can you tell me how you've been keeping up with that?
It's changing so fast and it's really hard to keep up with it. I'm a member of Professional Society, so I'm a member of AMSPA. They have very good articles in there, and I go to conferences all the time, and I do educational events at least a few times a year to make sure that I'm up on my skills and also the latest technology and recommendations. But I also find that quite a few of my aesthetic colleagues are really collegial. You wouldn't necessarily expect that in such a competitive field of industry, but they're actually really great about if you have a question or a concern, like reaching out, and they'll give you feedback and their opinion. I asked one of my colleagues just last week about their feelings about some filler and what their thoughts were on how we could make a particular concern improve it, and they were really open to giving me their thoughts and point of view, and what filler that they would use for it and how they would inject it. And so like those things are really great and important if we're gonna do things safely for people. Just having a cutthroat mindset of like, no, I'm not going to share my information is not good for patient care. So I feel like especially in Colorado Springs, where I'm at, all of my colleagues are really, really great to talk to. And like I mentioned, I do have some plastic surgeon colleagues that I reach out to, and I refer people to some dermatologists, and they're all just so helpful.
Oh, that's really great. I think the way that I see this is, yes, everybody wants a slice of the pie, but the pie is really big. and so if we all lead each other to the same pie, then not only do we do better, but more importantly, our patients do better.
Exactly. It's kind of the mentality that a rising tide lifts all ships.
Right.
So it doesn't help, because if you have a bad outcome with a procedure, not only does that hurt you personally, but it hurts the procedure, like the name of it. So if somebody's like, oh, well, I had Morpheus and I had a terrible result, that hurts the name of Morpheus. And then you don't want that. I mean, because maybe somebody just didn't know how to perform it correctly, or maybe the person just didn't tolerate it very well, or whatever it was.
Sure.
But that hurts more than just the person who did the procedure.
Yeah, and the patient themselves. Yeah. It hurts other prospective patients as well, for sure.
Exactly.
In terms of other aesthetic trends, GLP-1 is a huge thing. GLP-1 agonists, And so what's your experience been on how patients do with it and how it affects their aesthetic and how their aesthetic journey may change being on GLP-1 agonist?
Yeah, so that was something, so I do offer them, and I actually didn't start off by offering them. I only started offering them because I was trying to get the brand name versions for people in my family medicine practice, and was obviously I heard the demand for them. And for people who were unable to get it covered by their insurance, it was really frustrating for me and for them. And some of those people just went online and bought it, and Lord knows where they got it from. So I don't even know.
Yeah.
So
could be from Etsy, right?
Exactly. So I figured they're going to get it somehow. So I would rather provide them a way of getting it where I've vetted the pharmacy. I've, had a discussion with the pharmacist and how they quality control and all the measures that they take. So I could at least provide it in as safe a way as I possibly could do. So I do offer that here in my practice. One of the ways that I do it is I require like visits with me, and we do, body composition analysis. I offer lab work for people. I've diagnosed 2 people with diabetes since I started offering it who didn't know that they had it before. So, I try to take as many steps as possible so that people are getting it safely and taking it safely. But it definitely creates this level of, I don't want to say dependency, but I've encountered where people have a fear of coming off of it. So I've recently developed some strategies to try to transition people to more of like healthy lifestyle during, while they're on the medication, so that we can transition them off in the future. Because I don't believe in this mindset of like, oh, you need to take this forever. Because, people achieve their weight loss goal, and I feel like it's reasonable to try to get them off the medication. So that's one of the things that I've recently started to really approach with people, is how to live life without it. But you also run into this issue with like a lot of loose skin for some people who've had like a lot of weight loss. I've had people who've had over 80 pounds of weight loss.
Wow.
Some of those people need surgery. But, if we can be proactive as they're losing weight, I really try to talk about some of our skin tightening procedures and approaching that with people, and some of our facial contouring like options, so that when they lost the weight, they don't look like they've lost 50 pounds, because nobody wants that. You feel good in your body and you look older because you have sagging skin. That's something that you need to be a little bit more proactive about. I do have regular conversations with people about those sorts of things. And definitely if you're exercising during this process of weight loss, it helps that. But, sometimes people don't have that discipline to be exercising aggressively while they're losing weight so easily.
Yeah. And I'm sure you've come across patients who have trouble losing weight despite improved lifestyle. And so tirzepatide, semaglutide, that's kind of our GLP-1 agonist that not just control diabetes blood sugar, but also help you lose weight. So yeah, in a sense, that's a nice help to get over that hurdle for a lot of people, right?
Yes, absolutely. It's frustrating when you feel like you're doing all the right things that people, say like, oh, just eat less and exercise more, and you're not seeing changes with that. And, especially women, like that perimenopausal, postmenopausal age when your hormones are changing, like that's a really hard time for a lot of people to lose weight. And, those women, they still feel young and they're still active, and don't want to be 20 pounds heavier than they were 3 years ago, so I really empathize with that. And I do feel like they have a really good role. Just, sometimes you have to be more aggressive with some of the things that it can lead to, like the loose skin and sagging skin. Are you noticing a lot of that in your practice where you're having to do more like facelifts or neck lifts on people or even body lifts?
Well, so I do face and neck only. So I trained in ENT head and neck surgery. So that's all I know, and that's all I care to do. Learning about this on down is a lot more for me, and I like being specialized where this is. But in terms of Ozempic face, as people like to call it, there are more and more patients who come to the office having lost volume and are drooping. And so the way that I categorize aging in general is there's atrophy and then there's gravity. And so some people have one or the other. Some have most have a combination of both. And so actually, I have another episode about what to do about Ozempic face and how to fix the atrophy. And so, that along with Dr. Degurse's resources are going to be in the captions. But safe to say that there are a few ways that we advise our patients on how to help this concern. And so we walk through with them kind of, what fillers will do, what Sculptra or a hyperdilute radius will do, and then what fat grafting will do. And then for those who we deem appropriate candidates for surgery, we talk about that as well. So yes, it's a real thing. And I know that it will only continue to grow in its prevalence. So that's something that I think all of us in the aesthetic industry have to pivot our thinking into. A lot of our patients will be on this weight loss journey. So how do we help them continue to look younger and more beautiful?
Yeah, I think that's good. I recently heard about a trend where there are people out there removing the buccal fat pads. Have you heard about this?
Yep, I do a few every now and then.
You do? I was so surprised by that because I was like, isn't that kind of like necessary down the road? But I don't do those surgeries, so.
So the short answer of it is that fat pad doesn't atrophy like the superficial fat pads in our face seem to do. And especially in a lot of like the late 50s and up, those skinny women who want facelifts, often their jowls, a component of it seems to be buccal fat.
Okay.
And so when I'm performing the surgery, sometimes I do the deep plane approach. And after here, when I'm lifting up the tissues to resuspend them, oftentimes there will be a bloop in the operating field. And I'm like, oh, that's their buccal fat. I guess it's saying, come remove me. So there will be certain situations of that. But you're right. I think buccal fat had its heyday. And there are a lot of examples of Hollywood where people have humongous cheekbones and then absolutely nothing here. And then like this chiseled jawline. And I think that's phasing out as of 2024. And I think people are realizing more that volume is in. And I think it's going to be that way for a long while, especially in the face of what we're seeing with semaglutide and tirzepatide and the like.
Yeah. Okay. That's interesting. Thank you for the CME.
I don't know if I can officially certify you for that. But
that's all right. I won't claim it. I like to learn stuff.
But you will get a survey anyway.
Okay.
We love our surveys. Yeah. So one of the other things that I feel like may be coming as a result of the popularity of semaglutide and tirzepatide is perhaps a decrease in the usage of fat melting or fat freezing devices. Have you seen that kind of trend in Colorado?
Yes, some of that. Although I still find that it has some utility in specific areas of the body that are more challenging to lose weight in, or maybe you want to have that targeted fat loss faster than what your body's actually losing weight at. Particularly that double chin area is a big one, or that little fat above the knee, like that elephant knee area. That's a hard one to lose. And then especially for women after like C-section, you tend to get that kind of little super pubic or like lower belly pooch. That's really, really hard to lose. So those areas in particular, I'm noticing where it's still used quite a bit, especially as people will lose weight, but not lose weight in those places. And then it sticks out more. So
Sure.
usually they'll want to have one of those areas treated with it. And it's effective for that. I do more of the heat approach, not the cool sculpting approach. So I still will use it particularly in those areas. And it's useful for skin tightening in those areas too. So I still do quite a bit of like skin tightening for the body. Arms are really common, inner thighs, those places after weight loss.
Along those lines, what we are seeing more is the idea that it's not just about fat loss that's good for our health, but also building of muscle. And so do you have some of those modalities that help patients build muscle, or are there other programs?
Yeah, I do have a device that will help with the external muscle stimulation, the EMS. So it can help with muscle building. I find that is less popular just because it's less of that quick fix. It takes more time. But one of the things that I do when I do the body composition is make sure to point out muscle. And if there is muscle loss happening, we talk about strategies as far as increasing protein intake, talking about exercise. I have a PA who is in town who's a health coach. She does a very good job about coaching people on exercise. And so I'll give out her information to people if they need a little bit of accountability. We all struggle with that. So it's helpful to have somebody who can be checking in on that, like on a weekly basis. So I utilize some of my, local colleagues to help with maintaining muscle because, I talk about how important that is. You don't want to be a skinny fat person if you don't have muscle. So very important. And plus, really having a lot of muscle, especially in your later years, it helps with reducing fall risk. It helps prevent frailty, which is an issue if you're losing a substantial amount of muscle.
One particular group we were alluding to earlier is the perimenopausal and postmenopausal group, and I'm sure it affects them a lot as well.
Absolutely. That's usually where I struggle the most with getting people to exercise more is like if you get a 70-year-old woman in here who wants to lose weight, but they're like skinny, but they don't have a ton of muscle. So we got to work on building that as well as helping reduce their body fat percentage.
I'm just thinking about the range of topics we've covered, and we haven't even got to skincare yet, but it's kind of crazy how you start the conversation with injectables and then it goes into satiety modulators like GLP-1, into devices that help melt fat, to nutrition and diet. And it really is about whole body wellness, right? Aesthetics nowadays.
Oh, absolutely. I've been so surprised about how many options are out there. I mean, that can be kind of overwhelming for people, but it's
Oh yeah.
also kind of exciting that there are so many options available these days. When, if you think about the 90s, Botox was just kind of coming onto the scene. So
Hmm.
we're talking about 30 years, and we've got so many more options available to us.
Yeah. The way that aesthetics is going, I mean, skin is the largest organ in our body. And so I'm sure that you and your office staff have a lot of recommendations for patients with regard to their skin. So, what is something that you tell a lot of your patients that maybe is not quite mainstream knowledge yet?
Well, I talk a lot about medical grade skincare because, you know, I admittedly myself didn't quite understand the difference between medical grade skincare and what you purchased over the counter. If you look
Mm-hmm.
at the back, well, the ingredients are relatively the same. So this one is $20 cheaper. So why don't I go with the less expensive
Mm-hmm.
option? Um, but the quantity and the quality of the ingredients are quite different.
Mm-hmm.
And the best way that I heard it explained to me is that the over the counter skincare, they want to put as much of the ingredient in there as possible that'll treat as many people as possible. And if you go over a certain percentage, then you're going to run more risk of irritation or dryness or, potentially other reactions, depending on, the particular person. So
Mm-hmm.
they want to keep that quantity just low enough so that as little or a few people react as possible,
Okay.
which means that maybe it's doing nothing. So
Mm-hmm.
you could just be spending your money on something that has so little of the ingredient in it that it's not really doing what it you think it's supposed to do. So that actually does make a big difference. I've noticed a big difference in my own skincare regimen if I use one product versus another. I think that that's a concept that a lot of people don't grasp. Like, you don't want to spend thousands of dollars for a facelift or to get a procedure done and then put something on your skin that's not going to be beneficial to maintain your
Right.
results. It's kind of like
Mm-hmm.
getting your hair colored and then putting Suave shampoo on it. It's not a great combination. You got to protect your investment.
Yes.
And same thing goes with skincare.
If we think about our medical education, that minimum amount of ingredient that causes toxicity for relatively few people, that's kind of the, I guess, the very bottom edge of what we call our therapeutic window, right?
Hmm.
And at that bottom edge, there are very few people who are going to notice efficacy, which is the other side of the coin.
Yeah,
Mm-hmm.
exactly.
And
Yep.
so when patients first start using your medical grade skincare, are there a handful that say, oh, it feels too strong or it's irritating or it's itchy or anything like that?
Sometimes, honestly, very, very rarely, because, I try to do a really good history with people about what their skin is like, and then typically I'm taking a close look at their skin and seeing what I visually can see as
Mm-hmm.
far as their dryness level, texture, quality, those kinds of things. And then I also, the nice thing about a lot of these medical grade companies is they'll give you quite a lot of samples. So I will sample to people pretty often. I'll say, this is what I think is going to be a good regimen for you. I want you to try
Mm-hmm.
it for a week and
Okay.
let me know how you feel about it. Or I'll give them like two different moisturizers and I'll kind of explain to them the difference and like, try each of these and let me know which one
Mm-hmm.
you like better. And then we can always, get you a full size version. So, these things are more expensive than what you're going to find at most drugstores or, cosmetic stores. And
Sure.
I don't want people to feel like they wasted their money. So I would much
Mm-hmm.
rather give them like a small amount to try, and then they can give me feedback on how their skin reacted to it.
Mm-hmm. More recently, what's a popular ingredient in skincare products that a lot of your patients have liked?
Hyaluronic acid. That's probably one of the more popular ones right now. In Colorado, we're a really dry climate, so
Right.
it's actually, even though we get snow, it's actually a high desert plain, so
Mm-hmm.
very dry air, and that's a really good one for people who are prone to dry skin, which almost everybody is around here.
Yeah, of course. And I bet there's a lot of hyaluronic acid products on the back bar as well for your
Oh
skincare
yeah,
professionals. Mm-hmm.
yes, a ton of them, and at my house.
Yes, even better for
Yeah,
the whole family.
pretty
Mm-hmm.
much. My husband loves them the most. Like he's always like, "Oh, I need more of this serum,"
Mm-hmm.
or "I'm out of." He has this hyaluronic acid like lip mask that he's in love with. He like sleep with it overnight, and so if he runs out of that, he's always like, "I need more. Like, make sure
Mm-hmm.
to bring some home." Like, okay.
All right, your husband caught the skincare bug.
Oh yeah. Yep. Like spouses are always kind of like your first guinea pigs, for lack of a better
Yes.
word. So he gets to
Mm-hmm.
try everything first, and he actually loves it all.
That's wonderful. It's funny because I've had the privilege of practicing injecting Botox for my wife and also for myself. Like, I love injecting my masseters because I grind my teeth at night.
Yeah.
So, yes, you are your own good guinea pig, and your spouse is your own good guinea pig, too.
Yes. Yeah. I'm impressed that you could do your own master. I think I would be a little bit nervous about trying to do that one on
Mhm.
myself.
Yeah, just have
I'm
to
like,
be very careful in front of the mirror. And because once the needle's in, then you have to make sure you look at how much you're injecting. And so, yeah, I do it maybe twice, 3 times a year. And I do feel a lot of relief for that.
I've definitely injected myself with Botox too, but I've not gotten up the courage to do my own masseter.
I guess the reason why I find it easier to self inject my masseters is that it's such a big muscle.
Yeah. It's pretty
And,
easy
and
to
there's
fill, definitely.
and there's fewer nerve endings around here compared to right here because your supratrochlear and your supraorbitals are right there. So this is my step number one, and then maybe someday I'll self inject here.
Yeah. Yeah. I've done my own mentalis. That was the hardest one out of any of the forehead and the glabella. I actually did pretty
Mhm.
good, but the mentalis I was like it was a little bit of a challenge doing those ones.
Mhm. So for those of you watching on YouTube, the mentalis muscle is what I call your Robert De Niro muscle when he's in The Godfather and saying, "I'll give him an offer he can't refuse." And so that's what makes your chin look like an orange peel. And for the people who want a relief of that, that's a very good treatment. Um, Congratulations on growing your med spa so far. In terms of other trends in aesthetics, what do you think is something that we'll see in the next 5 years or so?
So one of the things that's become quite a bit more talked about or more popular is a lot more of the vaginal rejuvenation. So
Mm-hmm.
it's kind of is this idea of, whole body wellness, and women's wellness is kind of one of those really up and coming things. I don't
Mm-hmm.
offer that as of yet, but it's definitely intriguing, especially for a lot of those women in that same age group that we're kind of talking about before about we're talking urinary incontinence. It can improve
Mm-hmm.
that. Vaginal dryness and painful intercourse. Like those are all kind of the most like up and coming hot topics, I feel like.
Mm. Okay. In terms of whole body wellness, I think that's a very important component. And in terms of urinary incontinence, in terms of sexual health, pain with intercourse, I mean, I can't imagine that somebody would want to have intercourse with that kind of issue. So enabling somebody to enjoy that part of their life, I think, is a very cool way.
Absolutely. Yeah. These women are still youthful. They're still active. They want to play sports. They don't want to leak urine, and they want to still have a healthy relationship with their partner. So yeah, it's very important.
So my last two questions, and I like to ask my guests, what is something outside of the work that you do that you find makes the world a more beautiful place, that makes your life more beautiful?
I think it's important to, especially as a business owner, we're a small business, we give back a lot to our community. And one of the groups of people that we're really passionate about are adults with developmental disabilities. Mm-hmm. So we work really closely with a couple of groups in Colorado Springs that support adults with developmental disabilities. One of those is a group called Cheyenne Village. And both we support them through some of our services. We actually donate a portion of that service directly to them, but also with donating our time. And they have fundraising events, and we donate a lot of in-kind gifts to them. So I think that that's an area that we really make the world more beautiful, because that's a group of people that need a lot of assistance and maybe don't always get a lot of recognition.
So that's really wonderful that you and your office are helping adults with developmental disabilities through this program at Cheyenne Village. And so we're going to leave a link to Cheyenne Village in the description below if you would like to participate in helping adults with developmental disabilities. That link will be there for you to donate, to contribute in any way that you can. So my final question for you is, how can people find you, and how can someone become a patient of your office?
Thanks. So you can find us on our website, which is www.pearlskinbody.com. And you can book online there a consultation, or you can call us at 719-249-4210. And you can also reach us through Instagram at Pearl Skin Body, or Facebook, also at Pearl Skin Body. And then if you'd like to reach out to me personally, then you can reach me on my LinkedIn at Dr. Rachael Degurse.
Wonderful. All right. I want to thank Dr. Rachael Degurse for being a guest on the You Are Beautiful podcast. And indeed, she is making the world a more beautiful place from Colorado Springs, Colorado. Again, all the information to her website, her office will be in the description, as well as a link to Cheyenne Village for us to help adults with developmental disabilities. Thank you again for being on this show. And again, remember these 3 core truths. You are beautiful, you are unique, and you are worth it. Until next time, take care.